Hi there, my name is Kevin and this is my first video for YouTube. As you can see from the title, this video is about physical therapy. Now before I get into that, I'm going to kind of explain who I am and why I'm making this video. So, I am a physical therapist. I graduated in 2012 from a small school in Florida, and right now I'm working in a nursing home. So, why am I making the video? Physical therapy is pretty unknown. Unless you've seen a physical therapist or you are a physical therapist, then you probably don't have any idea what physical therapy actually includes. It's not just massage, it's not just exercise, you can't even describe it in one word. The reason I'm making this video is because as a physical therapist I have to teach people a lot. I have to educate, family members, patients themselves, so I figured this would be a good starting point. So, what is physical therapy? Physical therapists are experts in musculoskeletal impairments, as well as other areas. We tend to focus a little bit more on the musculoskeletal because it's more things that you can see. Our background as far as our education goes, you need to have a bachelor's, if not a higher level. Now, older physical therapists are probably going to still have bachelor's, but nowadays when you graduate, you're going to graduate with a master's or a doctorate. So that's an MPT or a DPT, Master's Physical Therapy, Doctors of Physical Therapy. So when you're in school, I'm not going to bore you with all the details, but you learn all about the bones, the muscles, nerves, ligaments, tendons, joints, arteries, all that stuff. So we are pretty well versed in the human body, in anatomy as well as physiology. So conditions that we can treat anything that will limit how much you can do physically. For example, someone who's just had a surgery, they're going to have a lot of pain afterwards, so we work on getting them up and moving around like they used to. Other conditions, people who have frequent falls, so that's usually the elder population, but not necessarily just them. Cardiac rehabilitation, people who've had surgeries on their heart, they also need physical therapy to improve their endurance, but you need to, figure out how much they can handle instead of just, having them run a mile every day. Another very common physical therapy treatment is for a very relatively unknown condition called benign paroxysmal positional vertigo, or BPPV. It occurs when people have loose crystals in their ear, but I'm not going to bore you with the details today. I just want to clarify something here. We are not medical doctors, so we can't prescribe medications, we can't do any surgery, we can't send you to get x-rays or anything like that. What we can do is perform a physical examination, and based on the results, we evaluate the results and we work towards improving all the limitations that we found. So if you have some weakness, we'll address that. If you've got some difficulties with balance, we'll work on that. If you've got tight muscles, we stretch them out and things like that. Like I said, we're not really massage therapists, but we do tend to use massage in our practice. So how are we different than a personal trainer? Well, a personal trainer will do exercises just like a physical therapist will. The difference really lies in how much training we've had. Now, most personal trainers don't have a graduate level degree. I'm not saying that none of them do, but most of them don't. They don't need that to be a personal trainer. Also, personal trainers don't generally help treat injuries. Now, personal trainers are intelligent. They're going to help you with those, but they usually are not that knowledgeable about injuries. Now, how are we different? How is physical therapy different than athletic training? Kind of the same thing. We just have more education. But athletic trainers are also well equipped to treat injuries. We work in a variety of settings, anywhere from a hospital to a nursing home to outpatient clinics to athletes at all different levels, from children all the way up to professional athletes. We have specializations within our field, so we can specialize in orthopedics, which is the musculoskeletal, neurology, so people who've had strokes or other like Parkinson's disease, things like that, pediatrics, children, geriatrics, which is the elderly, sports, all different certifications that we can receive as physical therapists. Now, physical therapists are also required to participate in continuing education in order to keep up to date with what's going on in the field, because our field is really focused on evidence-based practice, which really just means that physical therapists do research, and we use that research in order to help improve patients the most quickly, the most efficiently. For more information about a physical therapist or finding physical therapists, for more information about physical therapy or finding a physical therapist, you can go to the American Physical Therapy Association websites. That's at www.apta.org. So that's the end of this video. If you guys have any questions, just post them in the comments. Any comments, post them in the comments. I'll see you guys later.